Welcome to Dialysis Nurses Supporting Nurses. Today we're going to have a good time because I like to have fun. And one of the things that I like to do for fun is read package inserts. And this is fun. I like it. As far as package inserts go, Cathflo Activase or Alteplase is probably my favorite one. It's number one on my list. Number two is probably hepatitis B vaccine, because I just like what they do. So I don't know if it's the package insert or the actual medication that I like so much. And I'm not even getting paid to do this. I'm not a pharmaceutical sales rep. I just am doing this because it's fun. Let's review what Cathflo Activase does, so then you know why I like it so much. From my experience, if you spent any time at the dialysis clinic, patient, nurse coming into the dialysis suite to give a medication, you've heard the machine alarms. They're frustrating for everybody. They're frustrating for the patient, for the nurse, because it's not just because the alarms are annoying, because they are. Like, alarms are alarming. That's the point. But we don't want to be alarmed all the time. These alarms, if the catheter's not working well, like there's sludge in the catheter, but if there's sludge or clots building up in that catheter, it's not going to work well. I can't suck the blood out and I can't push the blood in. Sometimes when that happens, when I check for blood return, I describe it as sticky. Like, it'll pull and then it'll stick again. Kind of like the catheter's like, I don't know, it just goes like this to like this. And then imagine that on the machine when you're trying to go 350 mils per minute. It's going to go like that. And it's going to alarm, and then the machine is starting and stopping, and then the patient's blood pressure drops because they have lost blood volume, and they start to get nauseous, and then you can't pull fluid off. And plus, the patients are trying to rest usually. So it's not pleasant. Not just because it's not pleasant, it's also not good for the patient to have a poorly functioning catheter. We're not cleaning as well if that pump is starting and stopping. So their waste builds up, we're not getting the potassium out that we need, and we're not getting the fluid. So I guess what I'm trying to say, a catheter not working is a big deal. And the other thing is, this catheter is in the chest and it goes into a major blood vessel in the heart, or in like the aorta. And the machine is alarming, and it's starting and it's stopping. And then the nurse comes over, or the tech, they pause it, and then they unhook the machine, the lines, and then they flush it and they try to fix it, and then they reverse the lines and they put it back on. So now we're touching the machine, we're touching the catheter more, which really, best case scenario, we only touch it when we hook up and disconnect. So there's less risk of infection, but now we're touching it all the time, and it makes it a little more risky. And this is where Activase comes in. It is awesome. And I get a lot of questions about Activase. What do we reconstitute it with? How long is it good for? So let's find out. I haven't read this in a while, so we're in for a treat. Ooh, see, it's already gotten good, guys. I'm not gonna read this whole thing, so don't think that this is an hour long video, but I will read my favorite parts. First part, it's the very first line. Oh, I guess not. Powder for reconstitution for use in central venous access devices. When we think of Alteplase, we think some of nurses will think of TPA, what they put in stroke victims, which makes it a little like risky, like, oh God, you know, it's for strokes, but we're putting it in here. But here it says it's for central venous access devices, for our dialysis catheters. What is Alteplase? It is a tissue plasminogen activator, TPA, produced by a recombinant DNA technology. Okay, now we are getting a little wordy. For injection is a sterile white to pale yellow powder for intracatheter installation for restoration of function to catheters following reconstitution with sterile water for injection. Sterile water, not saline, which was news to me when I first started doing this, because I'm like, sterile water, really? Not saline flush? Sterile water. Each vial of Cathflo, gosh, I guess I find it all interesting. I'm almost going line by line. There's 2 milligrams in each little bottle that you get. Goes on to talk about clinical studies. I'm not going to read that. Contraindications. This is a good one. Oh, indications and usage. It's indicated, oh, we talked about this, but it's become very clear to me is indicated for restoration of function for CVAD as assessed by the ability to withdraw blood. Oh, I am such a nerd. For the restoration of dialysis catheters as assessed by the ability to withdraw blood. Has anybody tried to withdraw blood from a dialysis catheter and it's stuck and you have them cough and it's still stuck? I'll put this in it. It's just such a relief because you'll put this in the catheter and you'll let it dwell for at least a half hour or until the next treatment, and it went from not being able to withdraw blood to withdrawing blood, and then they have a smooth, wonderful dialysis treatment. Oh, here, contraindications. Should not be administered to patients with known hypersensitivity to Alteplase or any component of the formulation. See description. Ooh, this keeps getting better and better. Precautions. General. Catheter dysfunction may be caused by a variety of conditions other than thrombus formation, such as catheter malposition, mechanical failure, constriction by a suture, and lipid deposits or drug precipitates within the catheter lumen. These types of conditions should be considered before treatment with Cathflo Activase. That's true. I guess that's been true from my experience. They verify that the lines in, like when they're put into at IR, they verify that the line is in the right place with a chest x-ray, and then they also verify that it gets blood return right away. So some of these are already ruled out when they're placed immediately, but the other thing to be mindful of if you're having trouble with your catheter is to make sure that the, God, what is that called? The hub? Oh gosh. There's the catheter, it's, how do I describe it? It's just like this, but then at one part of it, it gets a little wider. If that little wider part is sticking out, then it's probably pulled out and it needs to be reevaluated. You know it when you see it. Trust me, you know it when you see it. Hopefully I'll think of what it's called before this video is over. Cuff. It's called the cuff. The cuff. What is a cuff? It's what I just said. It's a little, like think about a cuff, like a cuff like this. It's just a little, it's something different. That is where the catheter goes into the chest. And then this part, oh God, this is a really good description. Cuff, catheter. So the cuff, it just looks a little different, and that should not be seen. All right, and I guess we're getting to the end of this story. Dosages and dosage administration. It has something for if they're less than 30 kilograms. This is interesting. If catheter function is not restored at 2 hours after one dose of Cathflo, a second dose may be instilled. There is no efficacy or safety information on dosing in excess of 2 milligrams per dose for this indication. Studies have not been performed with administration of total doses greater than 4 milligrams. So if you TPA it twice and it still doesn't work, you might have to send them for a new catheter. This is what we're talking about. Constitution, preparation of solution. Reconstitute Cathflo Activase to a final concentration of 1 milligram per ml. Okay. Aseptically withdraw 2.2 mils of sterile water for injection. Diluent is not provided. Do not use bacteriostatic water for injection. Inject the 2.2 mils of sterile water for injection into the vial, the TPA vial, directing the diluent stream into the powder. Slight foaming is not unusual. Let the vial stand undisturbed to allow large bubbles to dissipate. I'm really getting to the good part of the story. Mix it gently, swirling until the contents are completely dissolved. Complete dissolution should occur within 3 minutes. Do not shake. That's in bold and all caps, so no shaking. The reconstituted preparation results in a colorless to pale yellow transparent solution containing 1 milligram per ml, and the pH is about 7.3. Cathflo Activase contains no antibacterial preservations and should be reconstituted immediately before use. The solution may be used for intracatheter installation within 8 hours following reconstitution when stored at 36 to 86 degrees Fahrenheit. That's a common question that I get is how long is it good for? What is good for? It is good for 8 hours. So if you're at the dialysis clinic and you know you're going to give it at the end of treatment because all you can do is 250 mils per minute, you can get it ready sooner. I would check your facility policy. From my experience, Only nurses can put this into the catheter, not the techs. So be mindful of that. No other medication should be added to solutions containing Cathflo activase. And then it tells you how to put it into the catheter. Withdraw 2 mL of the solution from the reconstituted vial and instill the appropriate dose of Cathflo into the occluded catheter. After 30 minutes of dwell time, assess catheter function by attempting to aspirate blood. If the catheter is functional, go to step 7. If it is not, go to 5. After 125 minutes of dwell time, same as before. 30 minutes, I'll instill it for 30 minutes if it's the start of a treatment and it's not working. I'll try it for 30 minutes, and that usually works well. And then they're just delayed a half an hour. But sometimes you do it at the end of treatment too. Then you get to let it. And the other day I needed to, I think it dwelled for a couple hours and it worked. It was awesome because I couldn't get blood return, and then I put it in and then we got blood return. And it's a relief for the patients too, because they get worried when their lifeline, when their catheter is not working. And then it says aspirate 4 to 5 mL of blood in patients greater than 10 kilograms, or 3 if they're less than 10 kilograms. Any unused solution should be discarded. Stability and storage. So this should be stored in a refrigerator, 36 to 46 degrees Fahrenheit. Do not go beyond the expiration date on the vial. Protect from light. It comes in a box, so that's good. So don't take it out of the box and then store it. Just keep it in the box. That's where you get these package inserts, when they're kept in the box. And then it talks about references. Who would have thought it could have talked 13 minutes about TPA? This is what it looks like. I'm telling you, this is a good one. Hepatitis B vaccines is a good one too, because it has a special section for vaccination of people on dialysis, people with ESRD. Thank you so much for tuning in. I wonder, I'm gonna have to get one of those other, I bet I can find it online, hepatitis B package insert. So watch for that video. Appreciate you guys so much. Have a good one.